When we look at ultrasound images, we see the blood vessels right away. You can see it without Doppler. This is a commonly injected muscle group in the forearm flexors. We are right at the edge of the pronator teres, and we see the brachial blood vessels coming down. If you were to say, try to aspirate your 25 or 27 gauge needle, even if you were in the vessel, you may not aspirate anything because it's so small. So going through this very common target, it would be very easy to inject a blood vessel. If you press down on your ultrasound probe, you actually obliterate it and you might not see it. So make sure you don't press too much. We are now in the lower leg off the medial border of the tibia at the flexor digitorum longus, and we see the tibialis posterior blood vessels going through that FDL. In some patients, it's more going through the tib post, but it is very clear that in this very small muscle group, you could easily be injecting toxin into the blood vessels. With ultrasound, it becomes quite clear, and you may change your view to go down deeper to the tib post. We have another image right here looking at the medial border of the brachialis. We can see that there are the brachial blood vessels, again, running alongside the nerve at this level, which is probably the median nerve descending down the forearm. Another zone to be aware of. This was forefinger breaths above the elbow. We can scan more proximally forefinger breaths below the axilla to get into the heart of the biceps. And here again, we see the brachial blood vessels very large. And in fact, around the brachial blood vessels, you find the brachial plexus descending. So you want to make sure that you are indeed in the correct spot at this zone and staying away from injecting directly into blood vessels or causing harm there. Phenol would be even more concerning because it causes thrombosis of the region. Here in the lower extremity at the flexor hallucis longus, which hugs the border of the posterior fibula, we can see blood vessels both in the flexor hallucis longus, but also in the overlaying fibular muscles or perineal muscles to be aware of as well. You don't want to get bleeding in this zone, causing a compartment syndrome or uptake of toxin in a blood vessel. Sliding posteriorly, we'll see the three levels of the gastrocnemius underneath at the soleus and the tibialis posterior. There's a very large blood vessel tracking through the tibialis posterior down the midline, your blood vessel, and a good zone to avoid no matter which way you are injecting. And of course, in a very fibrotic patient that has spasticity, these zones are very hard to see, making it even harder to see a blood vessel. We are now working on the flexor pollicis longus in the forearm. We can see the, again, radial artery pulsing very nicely. It's very easy to see and visualize the flexor pollicis longus underneath it. Next, we are going to the pectoral muscles, one of the most common injected in the shoulder girdle. If you are too proximal near the clavicle, the very large subclavian vessels will be there, and you certainly want to slide down the chest wall to get away from those vessels. This is a nice level to see the demarcation between the pectoralis major and minor. We see the fascial plane with the lateral pectoral nerve in it, and indeed a pulsing thoracoacromial blood vessel there. These smaller vessels are probably very unlikely to inject. Of course, we have the neck and the sternocleidomastoid overlaying the very, very large vessels underneath. You want to stay far away from the jugular region to not puncture. Going back to the starting place, we are now back at the pronator teres in a different model, and you can see the very large blood vessels underneath the pronator teres, often to an area that people might go to inject the finger flexor. So being able to see and visualize the blood supply is very important because it'll be different in every patient. And returning to the gastrocnemius and soleus, can you see the blood vessels without Doppler in this patient without me pointing them out? You begin to immediately have your eye go to those blood vessels when you're using ultrasound guidance. If we look here, you can see there's quite a large vessel right in the middle of the medial gastrocnemius, and there's one in the soleus as well. Two zones that you would like to avoid if possible when you are injecting. And this applies for botulinum toxin, phenol, alcohol, and diagnostic nerve blocks with anesthetics. And again, a nicer view of that blood vessel is seen right here. So be prudent. If you have the fortunate capacity to have ultrasound imaging and Doppler, we highly suggest you use it.